Good day everyone, I am Kanjan Tipon. So for today's video, I am going to demonstrate to you the brushing and flossing of the teeth. For the pre-interaction phase, remember the acronym CPAC. C. Check. Check records, medication record, or obtained an order if necessary. P. Procure. Obtain signed informed consent if needed. Obtains assistance if needed. A. Aseptic technique. Washes hands, dons procedure gloves if needed. C. Collect. Gather supplies and equipment before approaching client. For the orientation phase, remember the acronym CARES. C. Connect. Introduces self and instructor to patient. Identifies patient, read wristband and ask patient to state his name. A. Assess. Makes relevant assessments, takes vital signs to ensure that the patient still requires the procedure, is able to tolerate it, and that there are no contraindications. R. Rationalize. Explains procedure to the patient, including what he will feel and is expected to do. E. Establish privacy. Provides privacy. S. Support. Uses good body mechanics, position bed or treatment table to a working level, lowers the near side rail.
Good day, ma'am. I am Kanajin Tipon. I will be your student nurse for today, and I will be the one who's in charge to do your oral care. Is it okay with you, ma'am? Okay. But first, please state your name and your birth date.
My name is Shanine Ashley Gigiakaw, and I was born November 6, 2000.
Okay, let's start with your oral care.
For the working phase, remember the acronym CARE. C. Control infection. Washes hands before touching the client, before gloving and after removing gloves. Observes universal precautions, dons and changes procedure gloves when needed. Maintains sterility when needed. A. Aesthetic. Maintains correct body mechanics, performs procedure with acceptable style and art. R. Risk protection or safety. Explains rationale of procedure to the patient. Provides patient safety. Continues to observe the patient while performing the procedural steps. E. Efficiency. Performs procedure in an acceptable period of time. Demonstrates coordination in handling equipment. Follows correct procedural steps. Step 1. Prepare the client. Assist the client to a sitting position in bed, if health permits. If not, assist the client to a side-lying position with the head turned. Step 2. Prepare the equipment. Place the towel under the client's chin. Apply clean gloves. Moisten the bristle of the toothbrush with tepid water and apply the dentifrice to the toothbrush. Use a soft toothbrush, a small one for a child, and the client's choice of dentifrice.
Would you be able to do it yourself, ma'am?
Yes.
Step 3. Brush the teeth. Hand the toothbrush to the client or brush the client's teeth. Hand the client the water cup or mouthwash to rinse the mouth vigorously. Then ask the client to spit the water and dentifrice into the basin. Remove the curved basin and help the client wipe the mouth. Step 4. Floss the teeth. Assist the client to floss independently or floss the teeth of an alert and cooperative client as follows. Step 5. Remove and dispose of equipment appropriately. Remove and clean the curved basin. Remove and discard the gloves. Perform hand hygiene. For the termination phase, remember the acronym CARED. C. Check. Check patient's response to the procedure. Check if patient is comfortable, safe position with call light within reach, returns bed to low position and raises side rail. A. Aftercare. Dispose of supplies and materials accordingly to agency policy. R. Rewash. Washes hands again before leaving the room. E. Evaluate. Evaluates patient's general status. D. Document. Documents that procedure was done. Documents patient's response.